Another issue is the pain meds. Well, how can I manage my post-op pain? You've been given a regimen of IV pain medications in the hospital, then transition to a set of oral pain meds. Well, the first week is tough. It's always going to be tough. We try to get you as comfortable as possible. You're going to have different types of pain regimen that the doctor is going to be sending you home with. There's going to be instructions that's going to say every 4 hours or every 6 hours or every 12 hours. And these are as needed. So I would say the first week, you probably, if you're on every 6-hour pain medication, you're going to be waiting and say, okay, 5 hours, ding ding, 6 hours, give me my pain pills. And you could follow the instructions, okay? But again, it's as needed. So if you don't need it and you want to skip a dose, or after a couple of days you feel good and it's been 6 hours, you don't really need it, you want to extend it to 8 hours, that's perfectly fine. So if the instructions is every 6 or every 8 or every 12, but it comes time and you don't have pain, you could not take that pain medication and extend the time between your pain meds, so you're taking less pain meds and more duration in between, and that's perfectly fine. But the flip side is there too. The first week you're going to be like, okay, it's every 6 hours, but now it's been 4 hours and I hurt. So what should I do? Once in a while you could supplement with over-the-counter anti-inflammatories. So if you're not allergic to anti-inflammatories, which are Motrin, Advil, Aleve, and they're usually 200 to 400 milligrams tablets. So the standard ones are 200 milligrams. So usually a teenager, age 13, 14, can take 2 tablets. It's not a bad idea to take 2 Motrins once in a while, here and there, if you're kind of need it and you've done too much. And these are over the counter, so you don't have to really wait for a doctor's prescription and stuff. You probably have this at home, and it's not time for your regular pain meds. You could kind of supplement yourself with some anti-inflammatory medications, which I got to tell you, after 2 or 3 weeks you're off all the pain meds, that's the time you're going to feel the best. You're going to be like, wow, I feel myself, because most of these are narcotics and they kind of get you down. They're appetite suppressants, and they just change your mood, and you're kind of, you don't feel yourself. So once you get off all that stuff, you're going to feel much better, but you need it if you have pain.